welcome everybody to this month's call all about lymphomation, information to help patients who have lymphedema. So we're going to cover very specifically today, taking a look at skincare, which is a vital part of the management of lymphedema. So you've all met Rosia before. We do this call on a monthly basis. So Rosia, would you like to kick it off and just share what is important about skincare for you as a patient?
Sure. I think the most important thing is to not wait till all of a sudden your skin is totally dry and cracked in order to take action. So the sooner you start taking care of the skin and using products that are naturally based products, given that our skin is our largest organ in our body and it absorbs everything that you put in there. If we buy these lotions and these body butters and creams that have chemicals and other things, that is all going to be absorbed in your system. So that would be my number one thing. Don't wait too long. Start as soon as you can and get yourself a nice, thick, rich, something that feels good, that you can tell that your body is absorbing it. Obviously, it's not going to leave you all oily or anything like that, but that is also a natural product. That's number one. Number two, I do dry brushing, which is amazing. Not only it's good because you get to get rid of a lot of dead skin cells, which is so important because we lose a lot of cells throughout the day. But you get to move your lymphatic system and it feels really good. It feels invigorating. It feels like you're alive, honestly, because you're going to go very, very, very soft. And I think, Margie, you will spend a little bit more about it, but you go a little bit soft over the skin, always directing it towards the heart. And after you're done with your entire body, and I normally start from my toes up, and then I go the other leg, and then I do the belly, and then I do the arms, and then I do the neck. By the time you're done, you're ready. You're ready to take a shower. You feel good. And then you have done something really good for your skin too, because that allows new cells to grow. And then obviously after the bath or the shower, then you put on that lotion. And I go one step further. Before I go to sleep, I put on that lotion again. And you can ask my partner. He sees me every night. I put the same lotion on my leg, on my foot, between my toes. I even massage myself a little bit just to feel good. It's like a part of self-care that is so important. Another thing that I do besides the dry brushing and the using the lotion is I soak my feet in Epsom salt and apple cider vinegar. And that is a really good mixture because the Epsom salt is high on magnesium. And our body needs a lot of magnesium. It's actually the most important mineral in the body and the one that we are the most deficient on. So it's not a bad thing to then once a week soak your feet in some Epsom salt, add some apple cider vinegar. And what the apple cider vinegar does is that it kills bacteria and it also kills fungus. And it will get rid of all the cracked, dry skin that you might have on the heels or that you might have on top of the foot. Like I have to take care of that area too, especially where the toes are, where the toes meet the top of the foot. That can get very dry and it can get hard. So by soaking my feet once a week on the Epsom salt with the apple cider vinegar, and then I scrub them a little bit to help remove some of that skin, it really feels good and it is safe. And that's the best thing. It's safe. Those things are natural. You're not going to a pedicure place where who knows who's been using that area, who knows what products they're putting on you. They're not necessarily the highest quality either, and they're not necessarily the natural ones. So think about everything that you put on your skin, your body's going to absorb. So you want to make sure, just like you feed yourself well, you want to make sure that you are using something that is going to be good for your skin. In my case, given that I have lymphedema on the leg, I am very careful on stepping outside without shoes, making sure that I'm not, stepping on in a place where it can be dangerous for me, or where I can get a cut on my foot, or where I can get a bite or a tick or anything like that. So I'm always very much aware of that. Even I teach yoga, so most of the time in the yoga room, we don't wear shoes. But if I'm in the yoga room the rest of the day, if I'm not teaching, I'm wearing socks so that I protect my skin. And I also like to put the lotion on, not on the whole foot, I can't, because I have my compression, but on the toes, and take care of the little toes. They're so important. That's basically sort of what I do. But I one thing to keep your feet clean, keep your toes, your nail toes clean. Don't cut them too short either. That can cause fungus, that can cause ingrown toenails, but be very mindful of what you do. In my case with my feet, if it was in your hand and your arms, same thing. Then you would have to wear gloves when you handle different things, when you do different things outdoors, and always protect your hands and protect your arm. And I would say you can even probably soak your hands on a little water with the Epsom salt, because your magnesium is going to be good for you. You can even put a little oil. If you use essential oils, you can put oils there and soak your hands there. And the same thing applies, the lotion and protecting your hands. That's so important. I think you have to be a little bit more aware and cautious when it comes to the arms and the hands, because we use our hands so much, right? But that's basically most of what I do in my case.
And I want to just ask you, I'm just looking at your beautiful nails. So your lymphedema is not on your hands. No. It's your leg. So your hands are really beautiful in terms of your nails. What advice would you give for someone who has lymphedema of the arm?
Well, I would say the same thing with what I do with my feet.
I'm talking about the nails specifically, because it looks like your nails have been done professionally.
Yeah, my neighbor does them for me. My neighbor does them for me, so she's very gentle, and I try not to cut the cuticle too close. I try not to cut the nail too close either, just because you want to maintain them clean. You want to maintain them healthy. Taking collagen is also really good to keeping your nails healthy. People think, collagen just for the hair and the skin, but it's also good for the nails. So you want to also take care of that. Maybe take some collagen or drink some collagen. Little things that you can do that are natural, that you can do to maintain your nails better in a healthy condition. Right.
Awesome, Rocio. You've always got so many good tips to share. Thank you. And Rocio and I are really in a very lucky position with the company that we work with. Activated liquid collagen has become available, which is amazing. So that's not why we're here, but if someone is interested, they can talk to Rocio or I about that afterwards. So what I thought I might do, I just want to cover off on a couple of things. When Rocio said so rightly about keeping your skin clean, it's about what you wash with. Make sure the soap you're using is soap-free. It's not got all the activated ingredients that are toxic to the body. And some of them are actually carcinogenic. So it's really important to look at the ingredients of all the products that you're using. What's important is to dry well, dry very well between the toes and between the fingers. And what Rocio mentioned, we do not want any fungal infection. So when there's wetness between the toes, under the toes, around the toes, that can cause a fungal infection. And that in the long term is not only detrimental to your feet, but also to your nails. And once you've got that infection, it's very, very hard to get rid of it. So it's important to really be proactive. Every time you bath or shower, make sure you dry correctly. Rocio's already talked about the moisturize. What I'd like to talk about the moisturizing is, please steer clear of the perfumed moisturizers. That is really toxic. We want plain, natural products. So when it comes to, as we live, we do get cuts and grazes and so on. What is important here? Immediately, doesn't matter how the cut or the graze occurred, if it's on your affected arm or leg or body, wherever, it must be cleaned immediately with warm water and what you put on afterwards. Regardless of whether it's sore or not, you cover it with antiseptic cream and you put a cover on it. Because whilst that skin is open, even if it's a very light graze, the chances of infection are very high. And lymphedema patients are at risk of cellulitis. We want to avoid that at all costs. So when we say infection, they treat infection as an injury. So when I say taking care of your skin will prevent an injury, I mean it can prevent infection affecting that particular limb. So what are some of the signs? Rocio mentioned a few. It's visibly dry, it's scaly, it's itchy. And when those three things are present, the chances then are that the cracks can occur and a break in the skin. And that we want to avoid at all costs, which is why we so fanatical about moisturizing. And it's great that Rocio said she moisturized morning and night. I mean, if you can't do both, once a day is fine. Twice a day is even better. Now, this is an interesting little tip. When you are applying your moisturizer, I always apply it in the direction of my lymphatic flow. On your very last stroke of applying your moisturizer, apply it as the hair follicle is. If your hair follicle is pointing down, close the follicle as you apply the moisturizer. And you know what that does? It stops your hair follicle getting blocked. And there again would be another opportunity for infection, which we want to avoid. Just another little tip you might have to just put in your toolbox. Should you have any little cut or graze or whatever on your feet or your hands, always have a little bottle of surgical spirits handy, because just wiping with surgical spirits can alleviate any issues there. We talked a little bit about protection because we're talking about skincare. What is important is wearing gloves. If you're out in the garden pruning the roses, please wear gloves. If you're washing the dishes, please wear gloves. You don't know whether there's a knife in there. You don't know whether a glass is broken in the dish, in the sink. Always wear gloves, because also sometimes the ingredient in your dishwashing liquid is also toxic. You know, it's not always absolutely clean, and that you want to avoid any of that. When we talk about protection, we also mean when we're going out in the sun, please cover up so the arm is not exposed or the legs are not exposed to the sun. I like what Rocio said about never going barefoot other than when she's in her studio. And that's very important. Even when you're on the beach, you know what I recommend for my lymphedema patients? Even if they're walking on the sand, they walk with little booties. They're special little beach booties and swimming booties. You don't know whether there's going to be a sharp something in the sand where you're walking, or if there's even a broken shell, and all of that can cause infection. And then obviously there's repercussions thereafter. We talked very gently about the nail care. When you go to a nail person, and I really mean a specialist nail person, lymphedema patients should not be going to a commercial nail parlor, because as Rosie has said, you don't know what's been there, who's there, what they're using, etc., and how clean the tools are. You must go to, sometimes they call them a chiropodist, and today, more modern, they call them a podiatrist. Advise your podiatrist and chiropodist that you have lymphedema, and I promise you, they are aware of it. It's part of their training. They will be really careful the way they cut, the way they clip. And if you're doing it yourself, just make sure you use a clipper, not a pair of scissors. A pair of scissors, there's more chance of nicking your skin than you are when you're using a clipper. With the summer coming on, here we're still in the middle of winter, but I know Rosie's, look at her, she's got this gorgeous dress on with no shoulders and everything. We need to also protect ourselves about bites. We don't want any bites. And in the winter, like for me, we don't want to get burned, not too close to heaters, not too close to an open fire, all of those kind of things. With lymphedema, it can increase the swelling and increase the temperature of the skin, increase the fluid in the limb. So those are just little tips to avoid when we're talking about skincare. With the sun, I always recommend you use a 50 plus factor. Just another little tip. If you have lymphedema, just consider wearing a lymphedema alert bracelet. You just don't know when it might come in handy, where you're wearing it on the limb or on your ankle of the leg. Then at least people are aware should something happen to you. With your healthcare professionals, we're talking about skin. Be aware and alert them. Even if you've told them before, tell them again. You don't want temperature pressure bandages on when they're taking your high blood pressure on the affected arm. You don't want injections on the affected leg or arms. It must use the other or somewhere else. So what extreme temperatures can do for our skin? And the three issues are spas, hot tubs, steam rooms, and saunas. Those are, I'm not going to say are banned and never go in them, but are to be avoided at all costs. If you absolutely must do one of those, 3 to 5 minutes maximum and out. It's not good. That temperature, it just has a very negative effect on a lymphedema limb. So I have spoken before about cellulitis, and because we're talking about the skin, this is a risk factor for lymphedema patients. So these are the signs that you can look out for and just be aware of them. A redness, sometimes it's just little red dots, and the red dots increase. And they don't become one big red blob, they become a whole lot of red dots. And then that can increase. It can become painful. It can become more swollen. If you've perhaps had a slip or a fall and you've got a little nick in your toe, and there's a red streak coming from that point of injury, that red streak could be a sign of infection. And that means cellulitis could be already in the bloodstream. So what happens to you personally is high temperature with a fever. You generally feel unwell, and there's a loss of appetite. So what happens if that happens over a weekend and your doctor's not available? You go immediately to the hospital. You do not wait and say, oh, I'll wait till Monday. Cellulitis, it moves very fast. It can become endemic, and it's a very serious condition. I've had 1 or 2 of my patients who've been hospitalized for up to 12 days in hospital because they did not take heed of the signs. So as soon as you see that sign, you get immediately onto your GP if it's during the week, or go to emergency. The second thing is, if you are traveling overseas, go to your GP before you travel and ask for a prescription for very specific antibiotic ointment that you can put on your skin should you see a sign of those little red dots, so that your skin can be treated immediately. Never go without that, number one. And number two, a prescription for antibiotics should that develop into cellulitis. Because if you go onto antibiotics straight away, it can just hold it right where it is and clear it through the system. The one other thing I always say, always wear your compression garments. This is one situation where you don't wear compression garments. If you have cellulitis and the leg is warm and swollen and whatever, and you have cellulitis, please do not put on your compression garment. Elevate, yes, whether you're elevating an arm or you're lifting your leg, but until the cellulitis is back under control, do not use your compression garment. There's just one more thing I want to clarify. There's a condition, cellulitis we've talked about before, but lymphorrhea we have not. That is when the skin starts to leak lymphatic fluid. It usually manifests in a little blister. And it's usually not a big blister, it's a little blister. When that blister pops, lymphatic fluid leaks out. And of course, that's now open. It's what we call an injury, not really, but that's where infection can get in. So it's really important that when that happens, you take action straight away. Again, you put an antibiotic cream on, you keep it covered until it's healed. It's really important. It's not as common as cellulitis, but in my years of practice, I've seen it with maybe 5 patients. So it's not common, but it can happen. So just for a moment, I want to share the screen because I want to just show you this one page. On my website, it's NatureHealth.com.au/lymphedema/skin brushing. So there is an article which talks about it. There's a very short video there, and it talks about the benefit of skin brushing, of which Rosie has highlighted most of them. But the one thing that is great about skin brushing, it increases your lymphatic flow. And what you want is anyone with lymphedema wants to increase the lymphatic flow. So that is absolutely a great benefit of skin brushing on a regular basis. You'll see these are some of them here. It aids digestion, it tightens the skin, increases cell renewal, all of those things. So that's a list there. And also below, I've got some detailed information on how to skin brush, which Rocio covered, but it's all there with further details. So if anybody wants more information, they can go there. So I'll just stop that. Okay. Rocio, thank you so much.
Thank you.
Have a beautiful day.
You too.
I look forward to
Bye,
talking
Christopher.
to you.
Yes.
Bye. Nice to meet you.
Bye now.
Nice to meet you.